Hello, my name is Myrtle Greene, Director of Operations at IPN and Nurse Support Group Liaison. Welcome to the IPN presentation for facilitators and co-facilitators. The objectives of this presentation is to help you as a facilitator and co-facilitator in regards to your requirements, the IPN intake process, referral to nurse support groups, recommendation for group locations and financial consideration, co-facilitation requirements, required quarterly paperwork, relapse prevention education program, and an overview of the nurse support group rules. The overview begins with your facilitator's manual. This is a manual that must be read and signed by all facilitators and co-facilitators. You must comply with all terms and conditions. Any violation of the manual may result in cancellation of this agreement. The history of IPN. Legislation was enacted in 1983 for IPN to act as a liaison between the Board of Nursing, Department of Health, nurses, and treatment providers. IPN is here to assist nurses who have problems due to the use of drugs, alcohol, psychological, psychiatric, and/or physical conditions whose practices may be unsafe. You are required to possess and maintain an active Florida certification or licensure or have been credentialed as the following: PhD, CAP, LMHC, and for a list of all credentials, please follow up in your manual on page 2. You may be required to take a drug or alcohol test at any time at your expense if IPN has any concerns about your role as a facilitator. You may not act as a treatment provider or provide medical services to a group participant. You must carry liability insurance with minimum liability coverage of $300,000 per incident or occurrence and a yearly proof of renewal. IPN has no employment relationship with you as a facilitator. Therefore, you are not entitled to compensation from IPN. However, we will discuss compensation for your services later on in the presentation. You must sign an agreement with IPN yearly, and you may not act as an IPN group facilitator without a current agreement. You are required as a facilitator, co-facilitator, or even a prospective facilitator to attend the IPN mandatory training yearly held in the Jacksonville, Florida area. All facilitators are required to complete quarterly paperwork for each participant online by the deadline date. Failure to do so could result in the IPN nurse being refrained from working. So that is very important. IPN encourages co-facilitation of all nurse support groups to assist you as a facilitator. Co-facilitation roles can include supporting of the group process, noting any absences, assisting in the relapse prevention modules, modeling recovery support behaviors, and the completion of any required paperwork. Co-facilitators also have requirements. They must be approved by IPN. They must sign a facilitator agreement, carry liability insurance, and attend annual facilitator trainings. All co-facilitators are required to train with a facilitator for 6 to 12 months before being considered to become a facilitator. IPN participants may be considered for a co-facilitator role as well in a different group after successful IPN completion. IPN participants must demonstrate 1 to 2 years of sustained recovery and attend trainings to be considered for a facilitator role. Let's look at the IPN referral intake process. According to Chapter 464 of the Florida statutes, mandatory reporting is required when licensed nurses are known to have violated the Nurse Practice Act. Referrals are made to IPN from nurses, nursing employers, Board of Nursing, Department of Health investigators, treatment providers, and schools of nursing. IPN intake staff will collect the information, develop a plan that includes arranging an evaluation, referral for treatment, and development of an IPN monitoring contract. All IPN participants are required to provide their facilitator with a copy of the IPN monitoring contract. IPN participants are assigned to the closest group to their residential address. Once assignment to a group is completed, any change must be coordinated by IPN. Group location. IPN recommends all group meetings to be held in a safe environment, such as hospitals, churches, clubhouses, counseling centers are all feasible options rather than an isolated area. IPN does not recommend any facilitator to hold groups in their private residential home. Should you have an emergency, it is critical to be able to access help immediately. IPN recommends that you have a safety plan in place for emergencies, such as sickness, impairment, suicidal ideations, that addresses how, who, and what will happen in the event of an emergency. IPN recommends a nurse support group to be no greater than 8 to 10 participants, or no less than 4 to 5 participants. IPN has the capability to combine groups that are too small and reassign participants if groups have grown too large. Co-facilitation is always recommended for groups that have 10 participants or more. Financial considerations. As I stated before, you as a facilitator or co-facilitator does not receive any compensation from IPN for your services. However, you are encouraged to charge a reasonable weekly fee, keeping in mind this is a support group and not a therapy group. The usual fee is from $5 to $15 weekly, with the fee waived or reduced for any IPN participant not working in nursing. Many facilitators collect a set fee on a monthly basis in advance with no refund for absences. Also, some facilitators establish a fund using the monies to attend the mandatory annual training or to send a deserving member to our annual conference. In regards to the nurse support group rules, we recommend that you review and provide the nurse a copy of the group rules. Confidentiality is a must, but we do have some exceptions that include relapses, failure to attend on a weekly, consistent basis, or any major life-threatening concerns, problems that may affect the nurse's recovery status. Punctuality and attendance is very important to IPN. Prompt arrival is expected, and IPN supports a reasonable grace period of up to 10 minutes. Indicate on quarterly reports any habitual tardiness and contact the nurse's IPN case manager right away. Weekly attendance is required. Please report all no-show, no-call immediately to IPN case manager. Facilitators, you may excuse absences for illness, vacation, and etc. However, a pattern for absences should be communicated to IPN again. It is important for you as an IPN facilitator to set healthy boundaries. Having clear boundaries is essential to having a healthy, balanced relationship with participants. The purpose of having boundaries is to protect and take care of you as a facilitator and the IPN participants. IPN encourages all facilitators to set professional boundaries. Recognizing when you exceed these boundaries, you set up the participants and the support group for possible failure. Going beyond the parameters of your facilitator role creates an unfair expectation that your group members observe and may come to expect. I encourage you to have a relapse recovery focused group. Relapse may be discussed in group and appropriate support given. However, IPN protocol requires that participants report relapses to their IPN case manager. Also, you as the facilitator, you are required to inform IPN of any relapses within 24 hours. Nurse support groups must remain focused on recovery issues. The recovery maintenance modules are a tool that was implemented for IPN participation in 1997. Facilitators are required to complete module attendance and documentation monthly on all group members. This is an excellent tool for you as a facilitator to help the participants in regards to returning to work, managing their emotions, and the list goes on and on. I hope this presentation has been helpful to you in your role as an IPN facilitator. My goal was to discuss pertinent information that facilitators have inquired about in the past. Finally, I would like to thank you for your cooperation with IPN and above all, your willingness to serve the IPN nurses in the state of Florida. You are a valuable asset to IPN, and please do not hesitate to contact IPN for any additional questions or concerns in regards to this presentation. Thank you.